Welcome to the Agency Systems and Community Health Improvement webinar on Montana's accreditation strategy, using systems to comply. From the end of the webinar evaluations that you all provided, we heard that participants wanted more information and stories on performance improvement. So with that in mind, I'm privileged to introduce our presenters from the field, Lindsey Krywaruchka and Denny Haywood from the Montana Department of Public Health and Human Services Public Health and Safety Division, who share why and how their integrated management system is an effective strategy for complying with PHAB criteria for their department. I will just talk a bit more about Lindsey and Denny. Lindsey began working in public health in 2005 with the Yellowstone City County Health Department and currently works at the Montana Department of Public Health and Human Services. She's worked in chronic disease prevention and health promotion programs such as tobacco use prevention, comprehensive cancer control, cardiovascular health at the local level, and now currently leads the Office of Public Health System Improvement for the State Health Department. Lindsey has been involved in leading public health accreditation efforts in the state for the last 3 years. And sorry about the beeps coming in. It's always an improvement process here with learning the new technology. I'll be sure to get those off in the next webinar. And Haywood has been for 19 years in the field of organizational effectiveness improvement in both the public and private sectors. Prior to joining the Montana Department of Public Health and Human Services, he served as an internal management consultant with the City of Mesa and Arizona Game and Fish Department, and also worked with 2 management consulting firms. During this time there, Denny led improvement initiatives, taught workshops on corporate performance and management, and conducted customer and market research. He completed training as an auditor for the ISO 9000 Quality Management Standard, as an examiner for the Malcolm-Baldrige Criteria for Performance Excellence. He served several years as an examiner and examiner instructor for the state-level Baldrige Performance Excellence Program with the Arizona Quality Alliance. And thanks for sharing despite not feeling well today. And with that, I am going to hand it over to Lindsey and Denny.
Thanks, Lil. I just want to make sure everyone can hear us all right. Could you give me a confirmation on that, Lil?
Yep, I can hear just fine.
Great, thank you. Thanks for having us. We have a lot of information we want to share with you today, but I'm just going to introduce, kind of like the title says, our strategy for accreditation. I think there's 4 parts to today's webinar that we're going to take you through. So the first half, we want to talk about kind of the what we're doing, and lay out what an integrated management system is, what the concept is, and then how the PHAB criteria kind of fit within that system's view. And then the second half, we're going to kind of get to the parts, the how did we do this, how did we implement this in our agency, and then the case study that we want to share with you is just an example from the field, so to speak, of, okay, so we had this concept, how did it really play out in real life? Because we think that's obviously important to everything we're doing. So as you can hear, we're really fortunate to have Denny Haywood be a part of our team. I'm going to turn it over to him to start out with some details about the concept of the integrated management system.
I want to give a little bit of an overview about what an integrated management system is, just so that when we are using the terms and that we're all on the same page and understanding the same thing. And to start off with, I want to hit a couple key definitions. Is that of a system, interacting or interdependent processes. An example there is that a pile of sand is not a system because you take a bucket of sand out of the pile and it's still a pile of sand. But if you pull a carburetor from an engine, it no longer functions. So the concept that we're looking at as we think about an organization as a whole. The definition that's key is the term systematic, that is repeatable and uses data and information so learning is possible. One of the the key points that we'd like to emphasize is that they're defined and usually documented and consistently applied. So focus on the word system, systematic. So why is it important? All work, including management, consists of linked processes forming the system. Even documented or understood what the system is, there's a de facto system in place. And everything aligned to achieve the results it creates. So we're looking to improve performance. We understand the system, understand the processes, and work to change those processes to improve performance. The resulting system far exceed that of one that fights against itself. And if we know what the system looks like, it's not documented, it's not designed, then there can be opportunities to fight against itself. And then integrated management systems ensure that performance excellence happens by design and not chance. The focus here is that quality happens the first time, every time. So through the concept of the Montana Integrated Management System, and starting in the upper left of the diagram for needs assessment, this is the phase where we define the problems and priorities. Then once we know that, then to determine how we're going to, what the strategies are that we're going to use to attack that problem. Once we know strategies, then tactically on the ground, identify who's going to do what with what resources. Once it needs to be done, then allocate the dollars to do the planned work through the budgeting process. We have approval to move forward, then manage the work as we go through the year, and at the end of the year, evaluate, achieve the desired outcomes that we expected at the beginning. Then at the diagram, we get to look at support systems, and those are things like IT and HR, those things that give us increase our capability to do the work. And then together is the performance management system, where we determine a track with everything that we're monitoring in terms of tasks, dollars, and outcomes. Now, to get a better look at this from the public health perspective, if we look at documents that are used, oh, it is. I've seen it online. Okay. I'll start out with the state public health assessment as being that phase where we get the needs assessment. Then moving into strategic plan, the state public health improvement plan. Then to the different strategic plan, and in the strategic plans, like there might be coalitions. In Montana, there's coalition for disease. Strategies are, and they're documented. Now we need plans for the work plans. Who do what, when, with what resources. This feed into the budgeting process and allocate to the work plan. Once decided, then the same work plans are used to monitor, track the work as we go through the year, and use a database of program and activity metrics. Track and monitor, are we per plan? And then finally, look at strategic objectives and metrics that evaluate our progress for achieving the ultimate desired outcomes. Turn it for a minute.
So once we looked and said this is our integrated management system that we want to build in order to improve the performance of our agency, then we kind of also, at the same time, we're looking at the PHAB criteria, as all of you are, and wondering how are we going to achieve accreditation. I think when we all look at the PHAB criteria, it's our first reaction was to say, okay, we need a checklist. We have to build this spreadsheet and see what we need, when we need it, how we're going to get it. But when we were able to take a step back, what we really noticed was there are a couple of things that the criteria ask for. So in some places it calls policy and procedures, processes, and protocols, and then in others you're asked for just 2 examples. So we found ourselves in this place of saying, here's 2 isolated cases. It doesn't really mean that we're doing a good job. It kind of means we can grab a couple of emails from over here and prove that once in a while we do this. And it wasn't the approach that felt like we wanted to take, and it also felt kind of exhausting for the 100 and some measures that we are all looking at. So it really made sense to us then as we took a step even further back and looked at the the systems terms that were used in the PHAB criteria. And this is just kind of a list of those to say this they're getting at. We want to build a system that then just naturally complies to PHAB so that we're meeting those criteria, we're performing excellently by design, not by chance, and it just becomes a part of what we do every day. Because we felt the criteria were good, but they were more understandable when we organized them as a system. And so, in essence, what we're using then is the PHAB criteria to help guide the systems that we build, along with best practices in management and business. And our hope is not only accreditation, but then excellence in performance. So with that, I'm going to kind of inundate you with some slides in this next minute or 2. I'm going to go a little quickly, but I just make a side note that you will, or you did receive these, so you'll have reference if you'd like to. What we did is we went around and looked at, if we step back and take away the checklist approach and looked at the domains and looked at the standards individually, and in some cases the measures are referenced here, how do they fit into an integrated management system? So if we look at the first part of our management system, the needs assessment piece, we have some parts of 2 different domains that talk about needs assessment. Into the strategic planning piece, we have lots of different references scattered throughout the domains regarding strategic planning and how we use that approach. Optional planning, again, referenced in many different places, and we have a couple of measures there that really specifically use the term operations. So that just solidified for us that that was in the right place. And then that was referenced in domain 11 fits well with the systems that we need to build for our financial management. Then we move into the managing part. We felt like there were 3 domains that tend to be pretty prescriptive, so to speak, into what they're asking us to do. And so those things will be written into the operational plans of the programs with which they need to be done. And those would be referenced then for domain 2, domain 3. And so those ones that we felt these need to be a part of a work plan. They're necessarily a systematic thing that we need to be doing, but we need to make sure that we're doing the work, and we're going to do that in our operational planning. So then once we move on to from the management piece, we're going to look here are the details with the evaluation part. And then together, most importantly to us, was the performance management system. And really, the PHAB definition of a performance management system is great. It fits exactly with what we're doing, and we referenced that a number of times. The support piece is also one that's referenced. So together with the performance management system, you can see all of these things leading up to and feeding these activities that we're doing. We're tracking it. We're making sure we're doing the work that we said we would do, and seeing if we're on track with that in mind. The support function, just as those pieces, the financial management piece, the workforce development pieces, all those different research functions, those will have work plans and operational plans as well that support agency, and those would be informed by our agency's strategic plan. How to build a performance management system. I'm going to let Denny talk to you a little bit about that.
Fully functioning performance management system consists of processes, information, and systems that are used to set strategy, develop plans, monitor execution, forecast performance, and report results. And that what it took to build this kind of system and this approach tying all the pieces of the integrated management system together, there were steps that we'd like to talk about today. The first is constructing a logic model. The second, work plans. And third, establishing systematic progress reviews. So first, for a minute about constructing or how to construct the logic model. And for those of you that are familiar with the logic models, just understand that what we're doing here is an extension of that concept to try and tie multiple of the CDC logic models together at a higher level. I think that'll as we go along. For those of you who are not familiar with the CDC model, just kind of disregard it and we'll move on. The model, as we're defining them, consists of two things: the desired outcomes and the metrics. But they're in a chain of cause and effect, and which allows us to translate the strategies that are in the strategic plan to actual work on ground. So this is the structure that has to integrate all management systems. For example, and we're going to look at the Chronic Disease Bureau, might be a department or a division in your organization. If you see the size and scope of that work, it's huge. There's a lot of people, a lot of dollars, a lot of different moving things, and it's too intricate and complex to try and manage without having some structure. So these things are broken down into big chunks of work. Asthma prevention and control program or something of that nature. If you look at those still, they're large, they're complicated, and so trying to break it down into another smaller component. Now, talk about this, we had to come up with, again, standardization, systematization, and we are called second level the program, and a specific definition of what a program is. And the last chunk of work that is something that is manageable, that we can put our arms around, that we can plan and budget, we're calling core activities. So something very complicated, a little bit more manageable. Definition, it's a concept that's really key to what we're doing. And we define as a discrete unit of work with a common purpose. It can be a project, a work process, in particular thinking of it as a budgetary unit, and that comes out of accounting in a process or a concept called activity-based costing or activity-based budgeting. But for us is that this is the building blocks, the fundamental building blocks of our logic model. The program and then the core activities, the bite-sized pieces of work that we can describe and manage, home being, provider education, school and child care training. Now let's look of what makes up our logic model. The first is desired outcomes. If we think about the ideal end result, that if this your program succeeded ideally, what would be the end result that we would expect to achieve for having received the tax dollars that we're spending on this work? In this case, for the Chronic Disease Bureau, one of perhaps a suite of outcomes might, with chronic conditions, manage their disease and experience fewer complications. Then if we to the level for diabetes, individuals avoid diabetes complications and maintain quality of life. Cancer, fewer Montes experience late-stage cancer. And for asthma, then, the end result or the desired outcome would be individuals experience fewer asthma symptoms such that normal activity levels are not hampered. Now, can drill down to the cores that make up the program. For surveillance, public health professionals are promptly alerted. For patient, use a certain based practices. For school care training, the schools and child care facilities properly manage asthma. One addition for this now is to drill down to the work plan. You have a work plan that decides who does what with what resources, each of these core activities. then this is the task that we're going to do in order for Montana schools and child care facilities to properly manage asthma. Now, this diagram is to replace all of the arrows with the term "so that," and it is. We do tasks in the plan so Montana schools and child care facilities properly manage asthma, so that individuals experience fewer asthma symptoms, so that those with chronic conditions manage their disease and experience fewer complications. Everything in a chain of cause and effect. So that takes the desired outcomes. At metrics, if the results, how will we know when we achieve those results? They're a quantifiable measure for evaluating progress towards achieving those outcomes. So at a level, it might be statewide Montana chronic disease rate, chronic disease incident rate, statewide all issues. Then down for diabetes, number of individuals per 100,000. For cancers who are up to date with colorectal cancer screening. And again, it's just one example of perhaps a suite of metrics in order to communicate the concept. And then for number of asthma hospitalizations per 10,000. Break down now into the core activities. For surveillance, average number of days from diagnosis to entry into the asthma database. For provider in number of healthcare professionals receiving training. And then for child care training, number of staff or child care providers who received training during the past calendar year. Now again, all of these metrics linked in a chain of cause and effect. If the metrics for the core activities, surveillance, provider education, and school child care training improve, then that should cause the asthma program to improve. If the metrics improve, that should drive or cause the bureau metrics to improve. And all of the bureau metrics improve, that should cause or drive the entire department or division's metrics, which is really the state level assessment type of metrics. It should drive to improve. Now, without a detail, there's a whole lot of analysis and information that you can get by examining this structure. But one thing to point out is that at the more broad level, that these are things that tend to be measured annually or even in a 2 to 3 year time frame. At the intermediate level, these tend to be things that are measured monthly or quarterly. And then core activity level, these things that are very tactical, like the number of classes given, they measured weekly or monthly. That was some data coming in about our performance at this point in time that serves as a predictor of what the performance is going to be a year from now. If we had those high-level outcome metrics, it would be like driving a car looking in the rearview mirror. There's a shift between the desired outcomes and the metrics, so that, for example, on asthma, individuals experience fewer asthma symptoms. Then the metric for that might be number of asthma hospitalizations, and that relationship goes back and forth for all of these. I'm going to turn it over about, we talked structure of core activities, now we'll talk about how did we get there.
Right. Okay, thank you. You can see there's so much more information we have that we could share with you today, but we are trying to use our time well. So the value of that logic model is really, there's so much value in it that I can't say enough, but we're happy to share any questions at the end of this presentation. So now we want to move into a little bit of, okay, that's a great concept. How did you do it? Are you doing it? What's it look like on the ground? So the first is how we're doing this. We said we really needed to work with our teams and with people at all that do the work. So how we did this is we got work units together, because we defined programs and we defined core activities, and that's not necessarily how things looked when we really sat down after things got fleshed out. But we started by saying, okay, what already have in place that's a program? Let's get those that team of staff together, and we had a 3-hour work session. Everyone in that program came together in a room, and we asked a couple of questions to start some brainstorming. The first one being, what are the ideal end results of this program? The second, what tasks, what do you do so that those end results happen? How do you know that what you're hoping happens takes place? What do you do to get that work done? From there, we had some silent brainstorming that took place, and they were provided with a sheet of paper in front of them, and they were asked to put one task per sheet of paper. We had a list of words that they couldn't use, and such as facilitating, we meet with a coalition, we collaborate with these partners, because a lot of times that was initially a lot of those things that got put down, but what we found ourselves asking them was to do what? Because really this whole concept is shifting our thinking, that we're not just managing our goals, we're not just managing a budget, but we're managing our work. We're tracking the work that we do and seeing if it's accomplishing what we think it should, our desired outcomes are. So that was sometimes the question they hated being asked, but it was a really, really great conversation and really helped a lot of our programs kind of step back and be reminded why they do a lot of the great work that they do. So we used a really high-tech piece of called a sticky wall so for the brainstorming, and they were able to put all the tasks up on the sticky wall. And then we had them get up together as a group and organize those tasks by work that's being done that's kind of the same function and purpose. So group them by themes, so to speak. And then each group got a label. They would say, okay, what's the work being done here? And then give us a label. So again, we're focusing on the what, not the who. I'm going to make sure of an example. So this is there's our high-tech sticky wall, and you can see the pink papers on top are their themes that were just decided, and then the white papers below would be the tasks that they identified. For sake of time, we put up there that if you Google or look up an affinity diagram process, this is exactly what it is, and that'll kind of break down what we used for that function. So from work then, we were able to kind of put the pieces together for the logic model that said, all right, the top themes, those pieces of paper for the sticky wall, that would be what a core activity was. And every core activity then got a work plan. This picture you have in front of you, I would say sometimes it even got distilled down a little more. So there weren't necessarily 10 work plans for every program, more like 3 to 7. So everybody then got a work plan. What do the work plans look like? Well, and let me just say up front, it's about 2 pages. So they're not the work plans that we're used to as if we work for CDC, manage grants from HRSA, etc. These are work plans that really just say have these basic components in them. So the first one is the mission. What do we do and for whom do we do it? That's at the very top. And then the desired outcomes, again, the same ones that would be listed on the logic model that Denny shared with you a minute ago. It had a point there for strategic plan, goals, strategies, and objectives. What that portion of the work plan is it's really a reference to what are the other work being done in this work plan is not just being done for this one purpose. It often ties to many other strategic plans out there. So that was is the place on our work plans that references our state health improvement plan, our agency strategic plan, a CDC work plan we have, and then any other, maybe a state coalition plan, something of that nature. So those things are referenced here so that we're reducing that duplication of work, and we can go back when we need to report on those plans and reference RS. We don't have to kind of reinvent that work or recalibrate it. Next piece is an intermediate outcome metric. Now this is where we have kind of those longer term measures of success. So those bigger ones that are maybe an annual or biannual measure, something that says that our desired outcomes are really accomplishing something. Then process metrics, which get more down to maybe a monthly, quarterly measure, and kind of say, is the work that we're doing, are we getting the work done that we want to accomplish? So are we getting these number of people signed up with our diabetes managers? Are we getting this many people entered in to this quality management system? Those kinds of measures that say, is the work we're doing on track? And then we can plan portion that kind of sets out milestones of the work that we're doing and says, are we getting these big things done? And then the budget piece that helps our managers estimate budgets and look at, okay, I'm spending this amount of money to push this mission and this desired outcome. Does it make sense? Does it match up? And that's just a snapshot for you guys of what our work plans look like. It gives us the ability to work plans in our work every day because, again, we're shifting the culture here that we're managing the work that we do. So two pieces that we sat down with our units to put there. So when you look at kind of the big general way that we approach this every one of our programs, we had an initial initial brainstorming session that was 3 hours long. But I can tell you, we've gone through with 12 programs at this point, and every one of them appreciated this time. Definitely there was grumbling up front, but at the end of it, they all appreciated the time's well spent. As the program manager said, she said, if we don't know what we're doing, we need to stop and take hours and figure it out. If we don't know what the work is we're doing and why we're doing it, we have to take a step back. And I think we'd all agree with that. First, initially, we identified core activities, as I described to you a minute ago, and then took out a training that we had prepared and trained everyone on the logic model, which was very similar to what I went over with you guys at the beginning. Then developed the program logic model from there. And really, these are your core activities that you're doing. We identified desired outcomes, and then we said, okay, that's enough for 3 hours. You guys can go away, and we'll see it. A week later, we had another session with them, which was 2 to 3 hours, depending on the maturity of the program and the level of work and expertise that they had and what they needed from us. And that's where we really refined their logic model. We said, what desired outcomes are you accomplish, and then matched them and put metrics to desired outcomes. So how are we measuring the success there? Then we were able to do a work plan training and train them on all the components of the work plan that I just went over with you. And then one activities that had already been identified and said, you've been trained on the work plan, go away from this session and prepare one work plan based on this training, based on these tools and resources we're going to give you. And then a week later, we tried to, and they take their own time and prepare that first work plan independently as a staff, however they choose. And then hopefully within a week from that second session, we met with them and sat around and kind of said, okay, what work plan to develop? What does it look like, and how can we fine-tune it? And then from there, they left and complete the rest of the work plans for their core activities. So that's just the real general overview and timeline that we tried to follow with each of our programs here. But critical to all of this, so we have these logic models in place. We have work plans for core activities in place. I think we know that even at that point, this has the potential to not go anywhere, to just stay stagnant. In order for that not to happen, the most critical part of this is really establishing a systematic process review. And we've modeled what we're doing after other states and other programs doing this around the country. So we didn't by any means invent this. We really looked to them and their examples of CityStat and GMAP in the state of Washington and similar forms to this. So we've really taken a great cues from those programs and what they're doing. But what those progress reviews entail is just those work plans then, because as we have preached here, is that's how we're doing our work. That's how we're running our business here. So we sit down and compare current progress to the work plan with program managers and the staff, and it gives that program and activity manager a monthly opportunity to just review and say, are we on track? Did you get all of those residents signed up for the quality management system that you intended to? How are we doing on clinics that are implementing our colorectal cancer screening toolbox? And just have those check-ins so that before anything goes off the rails, we can catch it. we roll up, again, similar to the logic models, we have a bureau chief then is able to review all of their programs, and our division administrator is able to review all of the programs twice a year. So every 6 months, our division administrator has that opportunity to sit and to just get a quick look, okay, how are we doing? And it's not a punitive review. It's strictly how can we help remove barriers and what can we help do? So it's critical to keeping this system alive. So well, it's a system, what like and why would we do them? First of all, it's a systematic timeout to just communicate and evaluate progress with management. Not always the bad thing, not always about the negative things, right? About the big accomplishments that sometimes we don't hear about because some of our high-functioning programs, they don't get our attention very easily because we know that they're running quite smoothly. We can come solving about problems or roadblocks that we've encountered. And really important, again, at this point is our QI process. We'll touch on in a minute, but kind of get that in your head here that this is really where we're building our quality improvement culture systematically as well. So problem solving, again, sitting down with our leaders, anticipating roadblocks that are coming up, what can they do to help remove those barriers, and then develop plans to take a proactive approach, which sometimes isn't the way we're always used to functioning in any industry, and definitely in public health, but in any business that really have to work and be intentional about being proactive about things. And so that's what this does as well, and it initiates that corrective action in QI. For the progress review meetings, again, around the quality improvement models. Are we there yet? So we review the metrics that are set up and say, here's what we wanted to accomplish. Did we? And then the question has to be asked, did we do what we said we were going to do? We have metrics and desired outcomes there to help line that out for us and answer those questions. And we're tracking this regularly, which makes it, again, easier to take an at-a-glance view. And then with work. Did it work? Yes. Okay, keep going in the right direction. Did it not work? Well, what do we need to do differently? Is it that we weren't implementing our strategy the way we said we would, or is it we need a whole new strategy? And at that point is where we really have that problem solving and that quality improvement process come into play. And that's where we feel the corrective action can take place, again, before it goes off the rails, which is just a huge advantage in the work that we do. And this view, visually, I won't go over this again, reference this picture from our slideshow just for sake of time. But this is kind of visually from our integrated management system, how these progress reviews go play that system. Again, the performance management system in the center is what tracks and keeps in place all of these components, all of this information and data that help us review. But then we continually systematically go over it with our staff. Most of our 4 parts today is just want to go over with you, how did this work on the ground? How did you do this actually? Did you do this actually? So a quick case study. Maybe trying to change slides. Oh, here we go. Eating the elephant, so to speak. So a year ago, we had this entire concept in place. We sat down with I have the best team and you could ask for in our office, and we sat down and said, where do we want to be? We created that blueprint for where we wanted to be, and took the blueprint and we had a leadership team meeting off-site in December of 2011, and we said, here's our blueprint, here's our plan, here's what we want to develop. And for a lot of reasons that you all know, we needed their buy-in right from the get-go, and we got it. They were, some more excited than others, but I think in this process what we learned is that we learned who we needed to get on board right away. We didn't give our energy to the ones that weren't as excited. We gave our energy to the ones that were excited right off the bat. From there, we said the best thing to do is really pilot this so that we can pilot in a program that's willing, that's excited about this, work out some glitches, make sure that it's ready to kind of roll out completely. So we piloted it within one program from December to January, and that included those work sessions that I laid out for you a couple slides ago. And we carefully selected, like I mentioned, support people, and also a high-functioning program that really knew what they were doing, knew why they were doing it, and kind of think and manage systematically, and really had a good view of systems thinking. What at the same time is we have the CDC's Coordinated Chronic Disease Prevention grant. I'm sure many state health departments on the line are familiar with this, and that grant's really designed to bring our chronic disease prevention promotion programs together and kind of help them function a little bit more strategically. That opportunity worked really well with this. They needed a strategic plan, and we used this whole system to fund the Chronic Disease Bureau, the work sessions and the integrated management system building. And so we had 2 internal experts then got on board with that program, and they initiated 1 or 2 programs per week. So we were able to get 12, the Bureau Chief set the deadline, but from February to May, we were able to get 12 programs and end with 65 core activities done in that time frame. And really found, we have a lot of lessons learned that I can't go into for sake of time, but that just worked really, really well with the program to have all of these people on board. They understood why we were doing it. They were supportive. We got lots of good feedback from them, and able to kind of keep moving along to the rest of the division. So, but really quick, I want Denny to share with you kind of the results of what this, specifically the cancer program that we worked with to develop, what their results were.
Okay, Kat, the logic models that resulted, and this is at the Bureau level. And it's in small print there, but hopefully on your monitor you can see enough of it, that if we look again at this cause and effect type relationship, if I can look at the cancer control program, one outcome is that fewer Montanans experience late-stage cancer, and then is so that Montanans with chronic conditions manage their disease and experience fewer complications. So all of these desired outcomes in a chain of cause and effect at the program level, then at the Bureau. If you can imagine that we're going to double-click on this cancer control program and go to the next lower level, then this is the cancer program logic model looks like. And just a couple examples there. If we look at the top, early-stage cancer detection core activity, word outcome there is that age and income eligible Montanans, to breast, cervical, and colorectal cancer screening, so that fewer Montanans experience late-stage cancer. So ultimately at the Bureau level, Montanans with chronic conditions manage their disease and experience fewer complications. So if you take a look at this in more detail from the slides, but just to give you a feel for what it actually looked like, and then all of the metrics that are associated with each activity and each program, and then the Bureau. Just point out that in the upper left-hand corner of this picture is a logic model for the cancer program that the program wanted to blow up, laminate, and then they're using it in their staff meetings to guide which core activities are being discussed and reviews for their progress review meetings. So there's a work in progress, and we've got a lot of things left to do. One is to complete the work plan database development and rollout. We're with SharePoint, a database where we can store the work plans and the metrics, and that they can be updated dynamically on an ongoing basis continually as time goes by. There are bureaus to complete the work plans and then initiate what we're calling health stat, the management team, the division administrators, progress reviews of the programs.
Quick to wrap up, I think what we'd like to kind of, the home message here is really that we have a lot of good work being done in our bureau or in our division, and what we needed to do was bring it together with some key components that really are broken down into saying, you know, what are our strategies and objectives as a division, getting a work plan, and with all different components in it for each of our programs, and then looking at our work plan budget and expenditures, and then the program activities, the program bureau and division logic models, another key component. And then as we move forward, it's that SharePoint database, that dynamic sharing of the information along with regular progress reviews. Those are really the key things that are bringing our work from just kind of independent to working together strategically and aligning it. All right. So the message that we want for you today, just as a wrap up, is that organizational performance excellence relies on systems. That's really what we've learned. We felt like it's made from to improving our workforce to everything a lot easier when we look at it, how to build a system that meets this. And then building management systems that comply with PHAB, and building a performance management system that has these key components that we were able to discuss with you today.
And we've listed some additional resources to look on the web. One is the Baldrige Criteria for Performance Excellence. We've also benchmarked quite a bit the GMAP program out of the state of Washington, and then also CityStat out of the city of Baltimore. So with
I'll turn it back to you, Lil, for fielding questions.
Thank you so much, Lindsey and Denny, for sharing your work with us. I'm going to get right to the questions so we have enough time. So the first one is, how will you know what you're doing here will make a difference in terms of health outcomes? Does this connect to the health measures in Montana?
At this level, the logic model or originates, I should say, with the division, which is those metrics, those desired outcomes, are the health outcomes at the highest level, and the needs identified through the state health assessment.
Which, you know, the metrics and measures that we're using for those higher level health outcomes would be our BRFSS, our youth risk behavior, our vital stats records. Those types of data and health outcome information is what we'll use to measure that.
Okay. This is somewhat similar. How is Montana using and or integrating the healthy people objectives with these strategies and work plans? Are you planning to link the two systems in any way?
Yeah, no, I think what we're using the healthy people objectives for is as benchmarks, you know, to kind of say where are we and where do we want to be. So compared to these benchmarks that are set, are we, you know, how much do we have to grow? And so they're definitely helping us say those objectives up and those long-term intermediate outcomes as far as, you know, things like infant mortality or, you know, prenatal care, entrance into prenatal care, those types of things. We definitely use those measures to benchmark.
Okay, great. And while I'm going through these questions you've all written in, feel free to ask more questions in either the chat or the Q&A on the right-hand panel. So another question is how many programs have already done this in Montana, and how long do they expect to take until all the programs have a logic model? For instance, this participant has over 200 programs, and they probably don't have a logic model for all of them.
Okay.
What do you recommend?
Yeah, well, let me just really quick let you guys know we are part of a super agency. So we're the Department of Public Health and Human Services at the department level. Broken down from there, there's 11 divisions that we are one of 11 divisions. So we house all of the public health part, the Public Health and Human Services Department. But again, we have 10 other divisions that are the human services that are not doing this at this point. So we've really found, and what I would suggest to you, so far we have 12 programs within our division, but we have about 45 that we're looking at in the end. So piloting has been essential.
One thought that comes to mind is if we're talking about 200 programs, we have to be very careful about the definitions that we're using And are some of those really core activities? Are they core business processes and they're not a program? Unfortunately, people use the word program very loosely, and it really has to be clearly defined.
And this was something we had to kind of hit on right at the get-go, because even in our federal funders, definitions they change. What an objective is, what a program is, what a performance measure is different within every federal funding person they have. So we really had to say, okay, for our purposes, this is what the program is, this is where activity is, this is the desired outcome. We set that up right at the get-go.
And thus we developed a glossary and are using that to standardize the language.
Suggestion and how I would approach that would be find a pocket of people who are excited about thinking this way and pilot it. Start there and then just see how it goes. And what we found is then we were able to bring those program managers to our division meetings, to the staff meetings, and have them share the message for us. So it wasn't just us kind of saying, this is a good idea. It was people who do the work saying, this has helped me improve how I manage my program.
Good questions and responses. So the next one is, did you ever have any teams that you worked with that didn't work particularly well together? And if so, how did you handle that?
Yeah, I think that the thing here is that if you follow the structure and rely on the process, that let them grumble, let them go through, but they still have to complete the work. They still have to get the documents completed and got a deadline. But we all had the bureau chief that said it has to be done by such and such a date.
We did up from the get-go. We were the resource. We're not the hand. The leadership team's role. I mean, and not that they necessarily had to be heavy-handed, but they were the ones saying, this is it. And I can't tell you enough how the support from Chronic Disease Bureau Chief really assisted this process, because he was our big advocate in that whole bureau. And, there were never any kind of side discussions of, oh, just get this done, and it doesn't really matter.
But I will say the difficult teams were the minority, because going through the brainstorming session, they begin to see how this works, and then that provides motivation.
It's their work from the beginning. We're using their data, their work, to build from. It's just coming down saying, okay, here's what you do. It's tell us what you do, and not changing. We were really quick to say right at the beginning of our first presentation, and when we started rolling this out to our staff, that we're not changing the work that you do. We organize it and make it so that everyone in our division is managing their work the same way. And sometimes what would happen in those brainstorming sessions when they would, really this didn't happen too often, they had something maybe that came up and we said, well, you do this, why do you do it, to accomplish what? And if that question would be answered, then the program manager was just left to take that and do what it would. We weren't there to, out that direction for them. And I would also say, I had what I would always call, there was always a breakthrough moment. It was almost like there was tension up to the breakthrough moment when they saw, oh, this is why we do what we do. And it was very rewarding to see that. And literally, I can't think of one program that didn't appreciate this process.
Before the next question, I'm going to pull up the evaluation. We'd love to get your feedback. The next question is, how are intervening variables and environmental factors accounted for in your logic model?
I understand the question.
Sure. Well, if the participant could add a little bit more, but do you account for, maybe things within your control or out of your control in your logic model?
Okay. One of the criticisms or questions that we get while we're working through this is to say, well, I have control over that particular desired outcome. I don't have control over that particular metric. Well, it's true, but there's got to be some element of influence. If you don't have a way of influencing that metric or the desired outcome, then why are we spending money to do the work to try and accomplish that thing? And so it kind of brings the question full circle to some soul searching of saying, what is the real purpose of what we're doing, and are we spending money on something that is meaningful?
Measuring it in a meaningful way. You know, maybe we need to measure what's in our scope a little more.
Correct, yeah.
I think we only for one more question, but if you do have more questions, feel free to type it up and we'll get the answers to you and include a summary. So the next question is, and the last one is, how do your federal funders' deliverables, etc., fit into your performance management system?
Remember on the slide, and I can't go back to it, but in our work plans, there's a portion of our work plans that's, okay, thanks Liliana. I'm going to just go back through our slides if I can. One of our work plans that has a reference point for those particular components. I'm pulling it up, this right here, the strategic plan, goals, strategies, and objectives. So there within the work that we're doing, so I'm going to use a cancer example. One of the things that they're doing is getting toolkits out to clinics around the state of Montana to implement evidence-based interventions for colorectal cancer screening. So within that work plan might be a reference to what part of their CDC cancer, cancer funding, what goals long-term that fit into that work plan, they would be mentioned then in this portion right here, the strategic plan, goals, strategies, and objectives. That portion of the plan also would have a mention to our state health improvement planning objectives or goal that might be mentioned, our strategic plan as an agency. That's where all those things, I look at it as a reference point for those bigger funding sources.
And the metrics that are chosen would be the same or parallel to what the CDC contract would require.
We include less is more within the metrics and to use the same ones that you're required for your federal funders.
We always try to preach to focus on the vital few instead of the important many.
And they have it. Please, participants, join me in thanking verbally to our presenters, Lindsey and Denny from Montana, and please fill out the evaluation online. I've learned from you. Thank you for all the amazing questions. Have a good day, everyone.
Thank you.